have the final remarks. And then tomorrow we'll have diagnosis and treatment. But before that, we'll listen to a country about its experience in elimination. Although today is the day about elimination, tomorrow for a few minutes we'll give some time for the experience of Chile in the leprosy elimination documentation, and then we'll talk about diagnosis, treatment, neurologic assessment, and self-care simplified, Q&A, and then we'll close. That's basically the session for today and tomorrow. You can share your information with other people from your country if you wish. You have the registration link, so you can share that so that other people that you consider important to participate that or that might have some interest in being in this webinar because has some kind of work related to this subject, you can share your link today and tomorrow so that these people can follow us during these days. Thank you very much for this initial aspect and your attention. Now we're going to have an official opening for today. First of all, I will pass the floor to Dr. Lucianes, our regional assessor for the tropical diseases, unattended tropical diseases. Dr. Ana, thank you very much, Ernesto. Thank you very much, and good morning to everyone. Welcome for these webinars for elimination of leprosis and treatment. We thank you for your participation and the commitment that you show for being here in this space for this collective learning. Although we had great advancements in the last decades, leprosy is still present in many regions. In 2023, 25,000 new cases were notified in the Americas and 90% reported in the countries of this region. Today, we have as a goal to talk about key factors of fighting the disease as well as the technical process for elimination. And we'll talk about the processual landmark that establishes three fundamental steps: the interruption of the transmission and the elimination of the disease. Will share essential tools that will allow us to monitor the terrain in a strategic way, and we'll also present some guidance on the process of elimination, understanding that it's not only an epidemiological exercise but programmatic as well, reinforcing the political commitment as well as the multi-sector strategies that are needed in our countries, many regions of the Caribbean, Central America, and South America. We are very close to achieving our goals that were proposed, and we want to encourage you to take advantage of this space to share concrete strategies that can help other countries in a regional level. Thank you very much, and we hope you enjoy this webinar. Thank you very much, Dr. Lucianes, for these words, these welcome words. And now we will pass the floor to Dr. Vivek Lal, the leader of Global Program of the PAHO organization. Dr. Vivek Lal will talk about some aspects and also describe the situation, current situation of the process in a worldwide level. Dr. Vivek, the floor is yours.
Thank you so
Thank
much,
you
everyone.
very much.
Good morning to you all. On behalf of the WHO Global Leprosy Program, I warmly welcome you to this webinar on the new paradigm in leprosy. Now, in 1991, the World Health Assembly resolved to eliminate leprosy as a public health problem. This was based on a numerical target of prevalence less than 1 per 10,000 population. Globally, this was achieved by 2000 and by most countries by 2005. Thereafter, there has been a decline in reported new case detection globally. This led to a request from countries with very low numbers of cases to be recognized by WHO for having achieved a zero leprosy status. And this particular meeting was held in the PAHO regional office in Mexico City in February 2020. Subsequent to this meeting, the WHO set up a task force to propose definitions on the phases of elimination, identify cutoffs with verifiable indicators, and the targets. The new paradigm is that we have moved from the concept of elimination of leprosy as a public health problem or the control of leprosy to interruption of transmission and elimination of leprosy disease. The WHO technical guidance on interruption of transmission and elimination of leprosy disease was released in the year 2023, and this is what we would be elaborating upon during this webinar today. My dear colleagues, August 2024 marked a seminal milestone in the history of the disease, as Jordan became the first country to be verified and acknowledged by the WHO for elimination of leprosy disease. Dear colleagues, the concept of elimination is powerful to shape the recourse, the entire discourse in leprosy. It allows the countries to be recognized, establish and re-establish surveillance systems within the country, and reinvigorate the leprosy program. With this webinar, we aim to introduce you to the concepts, the tools, and the processes involved in interruption of transmission and elimination of leprosy disease. I will now be speaking to you about the global situation of leprosy. The Neglected Tropical Disease Roadmap 2021-2030 lists leprosy among the 3 diseases targeted for elimination. The Global Leprosy Strategy 2021-2030, for the first time, a 10-year strategy on leprosy is aligned to this NTD roadmap. It lays down a bold vision of zero disease, zero disability, and zero discrimination. The 4 pillars on which this strategy is anchored includes integrated country-owned zero leprosy roadmaps, scale-up of prevention alongside integrated active case detection, management of complications and prevention of disabilities, and combating stigma and ensuring human rights are respected. The Global Leprosy Strategy provides only the basic directions and strategic pillars at a global level. These need to be adopted and adapted at individual country levels specific to their contexts. A total of 182,000 to 815 new cases were reported for the year 2023. About 40% of the new cases detected were amongst women, 6% among children, who are aged less than 15 years of age, and the grade 2 disability among new cases stood at 1.2 per million population. The COVID-19 pandemic negatively impacted the program. It resulted not only in a decline in the number of new cases detected, but also fewer countries reporting to the WHO. However, we witnessed a build back during the following years, 2022 and 2023, with increase in the number of new case detections. In 2024, a record 184 countries and territories reported to WHO and leprosy. Zero case was reported by 56 countries, and another 47 countries reported less than 10 new cases. Only the 3 countries of India, Brazil, and Indonesia continue to report more than 10,000 new cases every year. Leprosy among children, as we are aware, is an indicator of continued transmission. The proportion of child cases varied hugely from around 2% in Sudan to more than 30% in Comoros. In the last 10 years, the child case detection has declined by almost 60%. However, a total of 110 countries reported no child cases. The grade 2 disability is an indicator of delay in detection. More than 5% new cases were detected with grade 2 disability. However, during the last decade, there has been a 30% decline in grade 2 disabilities. Child cases continue to be detected, however, with grade 2 disability. 266 such children were detected with leprosy who had grade 2 disabilities. Now I would like you to be introduced to concepts of autochthonous and non-autochthonous leprosy case. An autochthonous case of leprosy is a case of leprosy presumed to have acquired the infection following local transmission in a reported area. A non-autochthonous case is a new case of leprosy whose infection is assumed to have occurred in another country or area where they have been diagnosed. Epidemiologically, non-autochthonous cases are not considered a part of the local chain of transmission. 378 such non-autochthonous cases were reported in 2023 by 41 countries. Remarkably, 15 countries, all new cases were non-autochthonous. One of the countries belonging to the region is Chile. To summarize, countries have made commendable efforts, which is exemplified through an increase in reporting and a more than 30% increase in new case detection following the COVID pandemic. The new paradigm provides a unique opportunity to reinvigorate the program. And there is a continued transmission of infection, albeit in a clustered distribution. This is exemplified through transmission happening among children, new child cases which stand at 3.9 per million child population, our target being less than 1 per million children by 2030. The need, therefore, is to focus on strategies to interrupt transmission. Thank you. Over to you.
Muchas gracias, doctor Vivek, por su presentación. Em, Nuevamente agradecemos a los
I want to thank you,
conferencistas
Doctor, for your
por
presentation, and I want to thank
acompañarnos.
all
Esto hace
the
posible
panelists, and I want to ask for
facilitar
everyone
la
to try to
interacción.
speak as slow as
Doctor
possible
Vivek,
to
deja de compartir
help
su
the
pantalla.
translation. Doctor, could you please
Ok,
stop
muchas
sharing your screen?
gracias.
Thank you.
Ahora les voy a contar
Now I'm
los
gonna
aspectos generales sobre la
share
situación de la lectura
some general
estratégica.
aspects
Ya Vivek
about
habló sobre la
the
situación
process
a
in the
nivel global,
region.
pero ahora les voy a hablar de
He
la
talked about a
situación
global level, Dr.
en
Vivek
nuestra región.
Lau, and I'm going to
Ok,
talk about my our
entonces,
situation in this
primero que
region.
todo,
So first of all,
un poco recordando
I want
lo que
to
mencionó
remind
Vivek,
you of
el
what
número de
Dr.
casos
Vivek
que
mentioned. The number
conocemos
of
que
cases that
a nivel
are
global es de
notified
los 170
in the
mil.
region can
La
overcome
mayoría de los casos fueron reportados en
170,000.
la región de la
The
OMS,
majority of cases of
específicamente
the
India
Southeast
y la India.
Asia OMS,
Creo
especially in
que es
India,
el país del
or
mundo
basically in
que
India,
más reporta
which is
casos. Y en segundo lugar,
the country in the
la
world with
segunda
the
región
biggest number of
está la
cases.
región de las
And the
Américas.
second region is our region,
Y es
the region of the
básicamente
Americas,
porque el segundo país con
Americas.
mayor reporte de
And it's
casos
basically the second
a nivel
case with
global
report
está en nuestra región, que es
is
Brasil.
in our region, which is
Esto un
Brazil.
poco para observar la
And
tendencia
that
de
goes to
detección de
show
casos en nuestra
the
región.
trend
Desde el
in
2007,
case
el número de
detection
casos
since
disminuyó,
2007.
disminuyó
The
pues
number
hasta
has
que hasta el
decreased
2017.
consistently,
Entre
especially in
2016 y
2016,
2019
and from
permaneció
2016
estable en
to
los más de
2019,
30.000
it,
casos. Por
it
eso
stayed
decimos que antes
stable
de la
around
pandemia el
30,000
promedio de casos
30,000 cases. So we
reportados
say that
por, por
before
nuestra
the
región en ese
COVID,
periodo
the
fue
number of cases detected
270.000.
in our region
Pero en
was
la
around
pandemia,
30,000. But
debido a todos
during the
los problemas
pandemic,
relacionados con esa
all the
situación,
problems
el
with this
reporte se
situation in terms of
redujo de
detection
los
and
20.000 en
reporting
el
the
2020.
the cases decreased a great deal in 2020.
2021 hemos estado tratando
In
de mejorar la
2021,
detección.
we tried
La
to
detección se ha
improve our detection process, and
estabilizado casi
we built
25.000
back,
casos en el 2023
getting
en
up
cuanto a
to
personas
25,000 in
detectadas con ese reporte.
2023, and we are now putting
Uno de
together the
los aspectos
information
que
of
mencionamos
2024. One of the
muy
aspects that
importante
we
es
mentioned that is very
la asistencia en
important
eliminación.
for today's
es el
session
reporte de casos en
is
niños.
the report of
Como se
cases in
mencionó
in
en la
children.
presentación anterior,
As mentioned
el
in the
reporte de
previous
niños de la
presentation,
detección de casos de
the
niños es
children
muy
report
cercana a la
detection of
transmisión de
cases
la
with
niña y la
children
transmisión reciente. Es decir,
is
todos
related
los
to
reportes
the
de todos
active
los reportes de
transmission. That
casos
is
en
to
niños,
say, in
esto puede
territories where
ocurrir
we
peor aún
report
si es
cases in
transmisión
children,
reciente y
it
transmisión
means that
sostenida.
we
Entonces,
might have
esta
a
frecuencia es más
recent
o menos igual.
transmission or
En este
sustainable
caso estamos
transmission.
hablando de casos
And
detectados
we
en
see
niños,
a similar
pero desde el
situation here
2021
with
el número
cases
de casos ha
detected in
aumentado.
children. And in
En el último año, los
2021, the
reportes
cases have
detectados en
increased,
children
and the
han
last year's
subido y casos
report
en niños
of
han bastante.
2023, it
Otro de
went
los
up as
aspectos
to almost
importantes que
1,000. And
tenemos que
one
resaltar es la
other important
discapacidad.
aspect is
Como en los niños
the disability.
decimos que es un reflejo de la
With
detección
children, we
de
say that is a reflection
intervención
of
activa y reciente en una
the
ciudad.
active
La
and
discapacidad es
recent
un aspecto
transmission. The
importante que da
disability is an
cuenta de
important
qué está
aspect
ocurriendo con la detección
that
y si la
shows what's
detección de
happening
casos
with
es
the
oportuna. En general,
detection of
en
cases,
nuestra región, entre el 8 y
and
el
if it is
10% de los casos de lepra
precise,
detectados
around 8 to
presentan
10% of the
discapacidad
cases
severa, es decir,
uh,
discapacidad grave.
detected
Esto es bastante relevante
present
porque si en sus
a
territorios detectan casos con
important disability
discapacidad, esto
with
implica que
grade
esa
2,
persona
and that
no tuvo un diagnóstico
implicates
oportuno y hay que
on
evaluar
the
para mejorar
person not
si esa
having the
detección es
proper
oportuna. En
evaluation.
general, como hemos mencionado,
In
en las
general, as we
Américas,
mentioned
antes de la
in the
pandemia se
Americas,
reportaban
before the pandemic,
aproximadamente 30.000 casos. Como pueden
approximately
observar,
30,000 cases were reported
durante la
annually.
pandemia disminuyó esa
During the
cifra a
pandemic, the number of
20.000
cases
y
decreased
en
to
el
less
último
than
reporte de
20,000,
años,
and in the last report
2021,
in
2022 y
2021,
2023,
22,
ha
and
aumentado
23,
la detección y
the
estamos
number of
hablando
detection has
de
increased, and in the
detectados casi
last year, we have a
25.000 casos.
report of nearly
El número de casos,
25,000 cases
más del
reported in the
90% de
region.
los casos
More
reportados en las
than
Américas
90%,
son
90% of the
detectados en
cases in the
Brasil.
Americas
Sin embargo,
were
tenemos
detected
también
in
otros
Brazil.
países como
However,
el
we have
Caribe,
a group of
principalmente en
countries in the
Centroamérica, y
Caribbean,
dos
especially,
países
and
en
Central America,
Sudamérica,
and two
Chile y
countries
Uruguay,
in South
que
America, Chile and
tienen
Uruguay,
grandes
which have recorded
posibilidades de alcanzar los
fewer
picos de
than 10
emisiones
cases, and
actuales.
that means that they have a great
Entonces,
opportunity of
ahora
achieving
voy
their
a
current goals.
empezar a
So I'll
discutir
begin
los
now
aspectos esenciales
discussing
de lo
the
que es
essential
la
aspects
situación relacionada con
of the
las
situation
talasemias de niños,
related
los
to
aspectos,
the
los conceptos,
subjects
cómo se
of today,
manifiesta
explaining the
y
concepts and
qué
how
acciones debemos
we support
básicamente
this
observar
evidence
frente a estos
and what
conceptos.
actions can
Entonces,
we take
vamos a hablar
from that point on.
específicamente de la eliminación de
So
la
we'll
lepra
talk
y ese
about
tipo de
specifically about the
conceptos que
elimination of the
finalmente
process and
responden a
the
estas nuevas
concepts
definiciones
that
acorde con la
are
evidencia
strategic
científica actual.
milestones to support
Pero antes
evidence.
quisiera darles
Before
algunos
that, I
aspectos
want to give
claves.
you some key
Mañana los vamos
facts,
a ver
and tomorrow
cuando hablemos de los aspectos relacionados con la
we'll
clínica y el
dive deeper into
tratamiento
that
clínico de
and relate
de
it
la
to
lepra.
the Americans and
Saben que
treatment
la
of
lepra
the
es una enfermedad
process. As
crónica
you know, the
ocasionada por
process is a
bacterium
chronic
del
disease
Mycobacterium leprae que
that
puede
is
afectar o afecta
caused by
especialmente la
Mycobacterium
garganta,
leprae,
el
affects
área posterior
skin,
superior de
peripheral
los ojos
nerves,
y puede
respiratory
causar
mucosa, and eyes,
discapacidad
and can
permanente si no se
cause
detecta
permanent disability if
tempranamente.
not treated early.
¿Cómo se diagnostica la lepra?
How is it
Pues la
diagnosed?
Organización Mundial de la Salud
Well, the
dice que
OMS,
con
the
al menos uno de los
WHO,
criterios
diagnoses
específicos de
a
diagnóstico se
criteria or at
puede
least one
determinar que una persona o
of the
confirmar que alguien
following
tiene esta
to
condición.
determine or confirm that this
Básicamente
person has a condition.
clínicamente es una persona que presenta
Clinically,
una
we are
mancha
speaking about a
que
skin
tiene
patch
alteraciones de la sensibilidad,
with
pero
loss
también
of
hay la
sensation.
opción de
But
confirmar un
also,
caso cuando se
you can
detectan
confirm a
vacilos en
case
los ojos de la
with
niña, por ejemplo, o en una
bacillus and the
biopsia. Sin embargo,
vacilloscopy through a
el
biopsy.
diagnóstico en lepra, de acuerdo a la
However,
Organización
the
Mundial de la Salud,
diagnosis,
puede ser
according
basado
to WHO,
básicamente en la
can
evaluación
be based
clínica
on
sin
clinical
o con
examination, basically,
pruebas de
with or
laboratorio adicionales.
without smears
¿Cómo
or
tratamos la lepra?
biopsy.
Actualmente tenemos
How
un
do we treat it? The
medicamento
same
que
three
se
drug regimen we
menciona
have
que consiste
currently,
en la combinación de tres
an
drogas,
uniform one that
rifamicina,
consists
dapsona y
with the
ceftriaxona,
combination
y
of
la única
rifampicin,
diferencia
dapsone,
es
and
que se
sulfasamine.
recomienda 6 meses
And the
para casos
only difference
cardiovasculares
is
y
that
12 meses
it
para
may be
casos
used for all
neurovasculares.
patients, but
Algunas de
with
las
6 months for
estrategias
PB
que
and
nos
12
pueden
months
ayudar
for
a prevenir
MB.
lepra, en
Some of the
general, es
strategies that may
la
contribute to
detección
prevention
temprana y el
will be
tratamiento,
early detention
el
and treatment.
seguimiento
contact tracing, plus prophylaxis post-exposition, PEEP, with single-dose rifampicin. And of course, it's very important, education and stigma reduction to benefit all these aspects related to the approach. In terms of key concepts interrupting transmission and eliminating leprosy, as Vivek mentioned, we have the transmission interruption and the other one, the elimination of leprosy disease. Those are the definitions that we use in epidemiological terms to the elimination in some territories. If they have achieved one of these two, it's very important. But you need to know in this meeting that you need to understand this concept. So the first concept is the transmission interruption. And what does that mean in terms of program? What does it mean to do a transmission interruption? We have zero new autochthonous cases in children under 15 years of age. That's one example. Or if the territory does not have a period of at least 5 consecutive years of any disease detection in children. So that means that there might be a situation in which this territory has interrupted the transmission. When in this the second stage is achieved, we say that the territory has eliminated the transmission. So we saw that there are two concepts there that sometimes are confused and they might be confusing. So before we would say that the leprosy should be eliminated as a public health issue. Currently, we are talking about interruption of transmission and elimination of the disease. Before that, the goal of this disease would focus in some pointers saying that the main criteria should be that the country should have one case per 10,000 population prevalence. So it's related to the number of individuals in treatment. But today, what we are looking for in these definitions of main criterion is that territories should have zero new autochthonous child cases in 5 years, zero new autochthonous cases in all ages for more than 3 years. In the past, the process was mainly to evaluate the concepts of prevalence, and when achieved, we would say that this territory eliminated or eradicated leprosis as a public health issue. I want to emphasize today that although we have those two spaces necessary for these cases, for children or all cases, all ages, the elimination refers to the epidemiological issue and programmatic and social elements, as well as human right elements that would allow leprosis to be approached in the proper way in the territories. But in the past, we had a process in which was not necessary to do a validation or an assessment to talk about public health problem. But today, there's an option that a territory can do a documentation process, elaborate an expedient, and be recognized internationally in terms of leprosy elimination under these new processes. We've mentioned that there are some phases in terms of elimination that will determine facing the elimination of the transmission and the disease as well as the post-elimination. But I want to talk about these two concepts again. What's the interruption of transmission? Well, definition, as we said, zero new autochthonous cases in children under 15 years for 5 consecutive years. And why we're talking about children? Because we talk about the detection of cases in children that they are related to the recent and active transmission in a specific town. That's why we use this approach. And why do we use elimination of the process? Because this is the period that we assure that there are sustainability in this process to have a more feasible possibility to understand the specific period that needs to be covered.
un poco mirando esto, otros
Looking a
conceptos
little
que
bit
son
at
bastante
these
relevantes
concepts and other ones
es
that are
cómo entendemos
very
actualmente
relevant is how we understand
y qué es un caso en este
leprosy
contexto actual de la
today. And
legislación.
it is a case that
En muchos
is in this
protocolos ya se habla
this
de que es
current
un caso
context
nuevo, que es un
is
caso
we
previamente
can talk
tratado,
about a new case
que es
or
un caso pausibasilar, que es un caso
uh,
multivasilar y muchas opciones.
multivascular or
Pero
vascular
esas
case.
son,
There are many
digamos,
options,
los
but
tres principales
those
conceptos
are
que
the
usamos en la
three
legislación.
main concepts
¿Qué
that we
es un
use in
caso
elimination.
autóctono? ¿Qué es un
What
caso
is an
múltiple? ¿Y qué es un
autochthonous
caso
case or
esporádico?
non-autochthonous
Básicamente, un
case
caso
or sporadic
autóctono es, y
case?
esto es muy
Well, an
importante, y en
autochthonous
nuestras
case,
guías
and it's
ustedes
very
lo van a
important,
encontrar, no es que
and
se
you
haga una
see in
prueba
our
específica
guidelines,
para
it's not
que
that we do a
de ese test
specific
se
test
determine molecularmente que ese
to
caso es
determine
autóctono, sino
molecularly
con
if this
una
case is autochthonous.
evidencia
What we do is
epidemiológica
that
se
if with an
asume que
epidemiological
ese caso,
evidence, we
la
assume
transmisión o la
that in
infección
this
ocurrió
case,
en el
the
mismo
transmission
año
or the
en que pasó.
infection
Eso es un
happened
caso
in the
autóctono.
same year
Y un caso
where
no
it was
autóctono
reported.
es
And a
cuando
non-autochthonous
se
case
presume
is
que
when
la
the person
infección
likely
ocurrió en
acquired the
otro sitio
infection
o
in another
territorio
area or
diferente del
country
diagnosticado.
before being
Entonces, aquí
diagnosed.
pongo
So
dos
it's a different
ejemplos
territory.
autóctonos. Por
I
ejemplo,
give you here the
Carlos
examples
es una persona
of
de 45
autochthonous.
años que
Carlos
nunca ha
is
salido del sitio donde
45
vive.
years old, has
Fue
never left his district.
diagnosticado
He was diagnosed
en
during
una
a
revisión
local
médica
health
local y fue
check
detectado con lepra.
and was
Entonces,
detected
en este
with
caso, rápidamente,
leprosis.
como un ejemplo
In this
práctico,
case,
podemos
quickly as a
determinar
practical example,
epidemiológicamente y
we can
asumir o
determine
presumir que ese
epidemiologically
caso
and
es
or and we can
autóctono.
assume
Por el contrario, por
that
ejemplo, otra
this
vez,
is an
Lucía
autochthonous
fue
case.
diagnosticada
On the
en nuestra
contrary, on the
ciudad actual,
non-autochthonous
pero
case,
estuvo
Lucia
viviendo
was
por 8
diagnosed in her
meses en
current
un
city,
área
but had lived for
endémica
8 months in an
4
endemic
años
area
atrás. Es decir,
4
aunque fue
years
designado
ago.
en ese sitio, de acuerdo a ese análisis epidemiológico, se presume que esa persona no es un
You
caso autóctono,
understand that
¿sí?
this
No es
person
un
is
caso
not
autóctono. Pero
an
aquí
autochthonous
hay otro
case.
concepto que
But
es
here
muy
is another
relacionado cuando los
concept that is very
territorios van
related to
alcanzando
the
sus dos hitos. Es decir,
territories when they
cuando un
start
territorio ha
reaching this.
alcanzado la
When a
interrupción de la
territory has
transmisión o cuando un
reached the
territorio ha
interruption of the
eliminado la enfermedad.
transmission or has
Es
eliminated
el
the
concepto de
disease.
caso
This is a
esporádico.
concept of
Y esto
sporadic
es importante
cases. And this is
porque, como
important
ustedes pueden
because when
observar,
you
la
can
lepra como
notice
tal puede
lepers
tener un periodo de incubación que puede dar
can
desde
have an
5
incubation
años
period
hasta
that goes
20
from
años, en
5 to
promedio
20
5 años,
years,
o
an
puede
average
ser
of
un
5 years, or it can
variable,
also
pero
be
en general
variable.
su periodo de
But in
incubación es
general,
bastante
its
prolongado.
incubation period is
Entonces,
quite
aunque
extended.
hayamos hecho
So,
limpiado la
although
transmisión o hecho muchas
we have
correcciones, podrían
interrupted
eventualmente
transmissions,
aparecer
it
casos
could
aislados.
eventually
Entonces,
have
¿qué es un caso
isolated
aislado?
cases. What
Para
is an
estos
isolated
efectos
case?
con los
For
conceptos
the
y
effects
actualmente la
of the
legislación
current
colombiana, es un
concepts
caso que
of
aparece después de
leprosy
alcanzada
is
la
a case
interrupción
that
de la
arrives
transmisión o
after you
eliminación de
have
la enfermedad
interrupted the transmission
que no
that
está asociado a otro,
is not
¿sí?
related to
Y que ocurre,
it.
como he
That
mencionado,
occurs,
en un
as I
territorio
mentioned,
que ya ha
in a
alcanzado
territory that
cualquiera de
had
esos hitos. Es
reached
decir, a eso se refiere.
this
Entonces, por ejemplo, en
status
un
of no
sitio donde la
leprosy.
lepra ya
So
está
in a place
eliminada,
where
pero el caso
leprosy
está
has already been
identificado y
eliminated,
no
and you
tiene antecedentes de
inform cases that doesn't have any
viaje a otras áreas
track
o no
record
se
of any
conoce si
trip to other
tiene
places,
pues
or you don't
totalmente
know any
desconocido
other
su
place,
asociación con otro caso, pero es un caso
its relation with
completamente
any
aislado
other
que
case
puede
is
aparecer
totally
eventualmente en
unknown.
cualquiera de
So
estos
it's an
casos. Entonces,
isolated
estos son los
case.
conceptos
Therefore,
que
these are
ustedes
the
pueden observar,
concepts
pero
that you
vamos a
can see.
profundizar en
But
los
let's
próximos
deepen
años
ourselves in
en los
next years
conceptos de
in the
autóctonos y no
concepts
autóctonos.
of autochthonous
Y
and
por
not
eso en sus
autochthonous.
sistemas de
And that's why
información y
in
reportes, lo
information
que les pedimos
systems and
a
reports, we
caso
request
que
you
ustedes
that each
detecten,
case
busquen
that you
determinar
detect,
desde luego si
try
es
to
niño o es
determine since
niña
the
y
beginning
si es
if it's
autóctono o no es
autochthonous
autóctono.
or not.
Entonces,
So,
lo que quiero hacer o
what
queremos
I would
hacer en
like to
este
say
webinario es
now in
hacer un
this
resumen de
webinar
todos
is
estos
to
documentos.
summarize all
Actualmente
these
tenemos
documents.
ya por lo
Currently,
menos
we have
cuatro
already
documentos
at
técnicos
least 4
para explicar
technical
esto.
documents to explain
Entonces,
this.
al participar
So,
ustedes en este
when you
webinar,
participate
de
in
alguna
this
forma
webinar,
adquieren los
in a way,
conocimientos
you are
específicos
acquiring specific
de qué
knowledge
contiene cada uno de
on
estos documentos
what each
y
document
están
contains,
disponibles en la
and they're
actualidad en inglés y en
available
español.
in English and Spanish.
Eh, Todas las, digamos,
Let's say
recomendaciones,
all the
indicaciones y
recommendations,
orientaciones
indications,
técnicas
and
para
technical
abordar de manera
guidelines
técnica el
to
proceso de eliminación, pero en
approach
este
the
webinario
elimination
lo que
process
queremos
in a
es
technical
simplificar
approach. But we
todos
want
estos
to
conceptos para que en
simplify
la
other
práctica
concepts
ustedes
in
los
order for
puedan
your practice
implementar y
can be
entender de manera
implemented and
fácil y
understood
quizás
in easier way and perhaps transmit your knowledge to others. Once
esos hitos, pues existe un
you've
proceso que vamos a
reached
ver
this, you
hoy,
have a process that we'll see
de
today
documentación. Hay
of
que estar claro que
documents.
debe existir
It
un
has to be very
proceso
clear that you have to have
de permanencia de la vigilancia que se
a
llama
permanent
una transición a
surveillance
la
that is
vigilancia
called
post-eliminación
a
y el
transition
país
to
debe
surveillance
recolectar
after the elimination.
evidencias para
And you have to
mostrar que
collect
alcanzó
evidence
estos
to
hitos,
show that
pero
he
no
will
solo
reach these
epidemiológicamente,
levels,
sino que
but
hay unos
not
herramientas
epidemiologically
que
only,
dan
but
cuenta
with
de esa
tools
situación.
that
Entonces
will
hay
acknowledge the
compromiso,
situation. That
hay
means
un programa
commitment.
funcionando de
There's a
manera integrada
program
y hay un
that is
proceso de
functioning
vigilancia
integrally.
establecido, ¿sí?
Another one
Luego el
about
país hace
established surveillance.
una,
Then
si
the
considera que ha
country
alcanzado esos
that
hitos,
considers they have reached
somete
all
un
these
documento que se llama dossier
levels,
para
they issue a
a la
document
OPS a través de
to
su oficina local y
WHO, to
se
their
establece
local
o
office,
inicia un
and they
proceso de
establish
verificación externa.
the checking
Y se
process.
crea un documento
And
para,
they
como usted
create a
puede
document, the
imaginarlo, pues
dossier,
se
the
somete ese
evidence for the
documento y lo vamos
elimination
a
of
ver pues en
leprosy,
detalle,
and
que
we
se
will
llama
see this in
dossier, que tiene
details,
unos ítems
and it
bastante
has
establecidos y
everything
estandarizados.
very well established.
Como ustedes ven, eso es
And you can
básicamente. No
see,
olviden,
this is basically
les quería recordar que pueden
what I
aún
would like to
los
remind
colegas de
you
sus países
to
aún
your
pueden
colleagues in
conectarse
your
con el
countries.
webinario
They
de
can
hoy
still
y con el
connect
de mañana que
themselves
hablamos,
with today and
vamos a hablar de los
tomorrow's webinar,
electrónicos. Es
where
muy
we're going to
importante, queremos que
talk
nos
about
acompañen
the
en estos 2 días
technical
y
tools
básicamente lo que
and
quería
tests.
mostrarles en esta
And
primera
basically, what I
presentación
would wanted to
de
show
estos
you in the
temas
first
técnicos es
presentation
de manera muy
about these
sencilla, muy
technical
práctica,
terms,
qué es lo
very
que estamos
easily and
actualmente
practically,
abordando y
what are
vamos a
we
seguir
talking about
desarrollándolos
nowadays, and we will continue
durante esta
developing
sesión
the concepts during
específica sobre eliminación. Finalmente,
this
quiero
webinar. And
recordarles a
finally, I would
todos
like to
que
remind you all
actualmente tenemos
that
unos
currently
cursos en
we
línea
have
sobre
some
lepra,
online
que si
courses about
ustedes pueden
leprosy,
escanear
and you
en
can
sus
scan here the QR
dispositivos
code
móviles
with
y
your
pueden
cell
acceder
phones,
a
and
unos
you can
cursos
access these
en línea sobre
courses
lepra. Tenemos versión en
that are
inglés y versión
online.
en
We
español
have English
y pueden
version and
profundizar
Spanish
sobre
version, and you
temas
can
clínicos de la
get
enfermedad, cómo
more
tratarla
information about the
de manera muy
leprosy, how
fácil
to
y
treat it in a
accesible.
very
Son
well
cursos
and
bastante
accessible way.
cortos y
They're very short
pueden
courses,
compartirlo con sus
and you can
colegas para que
share them
también
with your
sigan
colleagues
aprendiendo sobre
in
este
order
tema.
for them to
Muchísimas
continue
gracias.
learning about leprosy.
A
Thank you very
continuación,
much. In continuation,
muchas gracias a todos. Voy
thank you very much to all of you.
a darle la palabra
I will pass the floor
al doctor Vive Clark,
to Dr. Viva
líder
Clark,
del programa global, para
leader
que
of
nos
the global
hable
program, for him to
sobre
speak
las herramientas
about the tools
que utilizamos,
that we
herramientas
use, the
adicionales, en otros
tools, additional
conceptos, que
tools
pueden ser
and
usadas por
concepts
los
that can be
países y
used
los
by the
territorios
countries
en el
and the
proceso de
territories
análisis,
in
de
the process of
monitoreo y documentación de la
analysis,
eliminación.
monitoring, and
Entonces,
documentation for the
doctor Vivek,
elimination.
le doy la
Dr.
palabra y puede
Vivek,
compartir
I
su
pass the floor to
pantalla.
you,
Muchas
and you
gracias.
can share your screen, please.
Thank you. Thank you so much. I will now take you, now that we have the conceptual foundations in place, I would like you to be introduced to the tools which are useful for verification. Now, the technical guidance on interruption of transmission and elimination provides guidance on the definitions, indicators, and milestones. It lays down the criteria for leprosy programs and the tools for monitoring progress and collecting evidence. Now, the main innovation here and an important concept to understand is that in case of leprosy, because of a long and variable incubation period, interruption of transmission and elimination do not occur at the same time. In fact, interruption of transmission precedes elimination of
Dr. Vivek,
leprosy.
sorry interruption. Are you sharing your screen?
Yes. Oh, it's not being shared? Sorry.
No, it's not being shared.
Oh, just give me a moment. Just give me a moment. Is it now on the screen?
It's starting to share. Okay, now I can see it.
Okay.
Thank you.
My apologies, please.
You can start once again. I don't know.
Yeah, thank you. So I was
Okay.
mentioning about the technical guidance, which provides for the definitions, the indicators and milestones, and the criteria for leprosy programs, the tools to monitor progress and to collect evidence. Now, the important thing to know is that because of a long and variable incubation period of leprosy, Interruption of transmission and elimination do not happen at the same time. In fact, interruption of transmission, as you would notice, precedes the elimination of leprosy disease. These phases therefore require separate criteria and milestones. The technical guidance provides 4 new tools: the Leprosy Elimination Framework, the Leprosy Elimination Monitoring Tool, Leprosy Program and Transmission Assessment Tool, and the Leprosy Elimination Dossier. Let us look at the first one, the Leprosy Elimination Framework, which provides the phases of elimination, indicators, and milestones. Now, the Leprosy Elimination Framework, it identifies clear phases. Phase 1, until the interruption of transmission. Phase 2, until elimination of leprosy disease. Phase 3, one of post-elimination surveillance. Now, 3 important issues I would like to highlight here. It is based upon the detection of autochthonous cases, as Dr. Nestor just provided us with. The second, that it is a bottom-up approach. And third, that there is a phase of post-elimination surveillance built into our leprosy elimination framework. Now, at the end of phase 2, the country can invite WHO, can present a dossier, and can invite for verification of elimination of the disease. Now, the verification of elimination of leprosy disease is done through an independent external team, which is set up by WHO at the end of phase 2. The process has 2 objectives: to ascertain the true absence of autochthonous new cases of leprosy. And for that, we have an important tool called the Leprosy Elimination Monitoring Tool, and to validate the presence of post-elimination surveillance, which is done through the Leprosy Program and Transmission Assessment Tool. Let us look at the first tool, the Leprosy Elimination Monitoring Tool. It is a simple tool to monitor the phases of elimination. It promotes a bottom-up process of achieving the milestones. It provides a detailed long-term overview at any desired level. Therefore, it allows managers and technical staff to anticipate the achievement of milestones and corresponding strategic and policy changes. Analysis of subnational level data from countries shows that secondary cases are extremely rare in low endemic settings. Further, modeling analysis has demonstrated the robustness and feasibility of a phased progression of milestones. That re-emergence of leprosy is very rare once milestones of elimination have been achieved. Now let us look at this case from Vietnam, where there is a consistent decline in leprosy new case detection over the years. It's a 20-year time trend. We have put this into leprosy elimination monitoring tool. What you would observe is that the leprosy elimination monitoring tool uses a traffic light color coding to define the phases. The phase 1, phase 2, and phase 3. It also highlights operational issues that can be identified as marked by this arrow. It can show a query operational cause for a sudden increase in high number of new cases, or a possible re-emergence which needs to be investigated. Second, what we can see is that the phase transitions are demonstrated through a change in color. So as soon as there is 5 years of 0 child case, it transitions into, from the red color, it transitions and moves to orange color. Third important point, which I would like to highlight, is that phase transitions need not be sequential. These can be concurrent. meaning thereby that the countries can directly move from red to the green phase, as is shown by the third arrow here. Because the 5 years of zero child case overlapped with 3 years of zero adult case. Therefore, the region moved directly from the red to the green phase without moving into the orange phase. This is the serial maps based upon the same leprosy elimination monitoring, basis which you can appreciate the change in colors of the various subnational units, basis the transitions on the based upon the new case detection in these regions. What started as an Excel-based tool has now been integrated into the DHIS2 platform. The DHIS2 platform would provide for for an analysis of each of these subnational level areas with individual color coding. It also provides for serial maps. And third, it can also provide you with an analysis of the summary basis the, the basis the identification of new cases. For example, it can actually tell us which of the subnational units had sporadic autochthonous cases, adult or child, or can identify and give us a summary of what are the areas where there is an query operational cause for high number of new cases which needs to be investigated. I will now deal with the next tool for verification, which is the Leprosy Program and Transmission Assessment tool. This tool is a leprosy program review tool. The purpose is to confirm whether a leprosy program at subnational or national level meets a predefined criteria. The tool covers all the programmatic aspects which are laid down in the WHO Global Leprosy Strategy. It is especially important in low endemic areas that may have achieved interruption of transmission and elimination of leprosy disease. However, this tool can be applied at both subnational and national level when it is for the preparation of dossier for verification. Now, who will use this tool and for what purpose? The Leprosy Program and Transmission Assessment tool can be used by the leprosy program managers to assess the status of program and related leprosy services. It can be used by the Health Ministry to acknowledge a subnational level area for having achieved interruption of transmission. This information collected at subnational health administrative units is then compiled as a leprosy elimination dossier to be submitted to WHO. The same leprosy program and transmission assessment tool will then be used by WHO to verify that a country has indeed reached the milestone of elimination of leprosy disease. Now, what is the LPTA comprised of? It comprises of review and validation of epidemiological data. It comprises of verification of program criteria through field visits, perusal of records and reports, and interview with key stakeholders. It also lays down health facility assessment through observation, perusal of records and reports, and interviews with key stakeholders. There are 3 program domains which are assessed through LPTA: political commitment, program implementation, and surveillance. These are the 3 most important components. And as I mentioned before, the importance of verification of leprosy elimination is that there should be an assessment of post-elimination surveillance, which is very important. To elaborate on the services and interventions, under political commitment, the LPTA looks into country-owned strategic plans, budget, integration, standard operating procedures, drug supply chain, having an enabling environment, which is very important. For example, existence of any laws which are discriminatory for persons affected by leprosy, social support, or any instances of discrimination. It also envisages stakeholder participation, including academia, networks of persons affected, and private practitioners. Under program implementation, the LPTA tool looks into integrated leprosy care package, referral systems, contact screening, post-exposure prophylaxis, staff training, and awareness of communities. Under surveillance, it looks into digital data management, reporting, mapping, critical investigation, instance investigation for sporadic cases. How are cases managed amongst migrants and internally displaced people, and involvement of private practitioners? This is the snapshot of the LPTA, which is used at subnational level, and a snapshot of the LPTA, which is used at national level. Again, what is important is that LPTA has also been integrated into the DHIS2 so as to improve the efficiency of the work, and it makes data collation easier. This is the suggested timeline for implementing the tools. For phase 1, we implement the leprosy elimination monitoring tool. Towards the end of phase 1, which is until the interruption of transmission, the country conducts leprosy program and transmission assessment at subnational level, which is an internal verification process and does not involve WHO. In phase 2, the country implements leprosy elimination monitoring tool. At the end of phase 2, the country conducts leprosy program and transmission assessment at national level, prepares the leprosy elimination dossier, and submits to WHO, and WHO would undertake the verification of elimination of disease in the country. Finally, the country enters into the post-elimination surveillance phase. To summarize, the new WHO guidance distinguishes clearly between interruption of transmission and elimination of leprosy disease. It provides a clear leprosy elimination framework, along with definitions, indicators, and milestones for each of these phases. The tools which are useful for assessment are leprosy elimination monitoring tool, leprosy program and transmission assessment tool, and leprosy elimination dossier. The leprosy elimination monitoring tool helps us to visualize epidemiologically the new cases, new autochthonous cases amongst adults and children. We can visualize and anticipate progress at subnational level, and it allows countries to work towards achieving the milestones from bottom up. The leprosy program and transmission assessment tool is used to do a detailed program review, not just epidemiological, but other aspects, as I mentioned, on political commitment, program implementation, and surveillance. It is applied at subnational and national level, and this forms the basis for the evidence which goes into the leprosy elimination dossier. Thank you. Over to you, Dr. Nestor.
Muchas gracias, doctor Vivek, por su importante
Thank you
explicación
very
acerca de
much,
estas herramientas.
Dr. Vivek
De
Lal,
acuerdo
for
al
his information.
orden,
According to the
técnicamente
agenda,
tenemos
theoretically, we have
un break,
now a break.
Quizás como vamos en un
But
tiempo adecuado frente a
as
la
we are
agenda,
in our
podríamos
time,
aprovechar
perhaps we
para
could take
responder
advantage to
algunas de las
answer
preguntas que nos han
some of
hecho
the
a través del
questions
chat.
that are in the
Y
chat.
algunas las hemos ido
And some of
respondiendo
them
directamente.
are going to be answered
Quería
directly,
aprovechar para
and I'm going to
un
take
poco
advantage
mencionarlas.
to mention them.
Jimena nos ha
Jimena
preguntado
is asking
cuántos y cuáles países de las
how many
Américas han
countries of the
solicitado
Americas have
recibir un
requested,
reconocimiento de eliminación. Es una muy
have
buena
received
pregunta.
recognition
Solo
of the
queremos
elimination?
mencionar que
This is a good question,
vemos
but
que
we have to
estamos
mention
avanzando con varios
that
de
we
los
are
países.
advancing
Varios
with many of
países
the
han
countries.
demostrado su
Many of the countries
interés
have shown their
en
great
acelerar las
interest
acciones.
to
Y
accelerate the
en términos
actions.
epidemiológicos hay un
In
grupo de
terms of
países en
epidemiology,
Centroamérica, en el
we
Caribe,
have
y
some
hay dos
countries in
países en
Central America and
Sudamérica
the Caribbean, two countries in
que
South
tienen
America
unas
that
condiciones
have some
que
conditions
han mostrado que tienen
that have
altas
shown
posibilidades de
that they
alcanzar
have high
los dos
possibility
hitos que
to
son la
reach
interrupción de la
the
transmisión y eliminación,
interruption of the
de acuerdo a
transmission and
los parámetros
elimination
actuales.
according to the
En
current
Sudamérica, Chile y
parameters.
Uruguay
In
tienen
South America, Chile
una
and
alta
Uruguay
posibilidad de
have a
alcanzar
high
estos
possibility
hitos,
of
y
reaching
seguramente
these
mañana cuando
milestones.
Chile
And surely
muestre
tomorrow,
su
when Chile
experiencia, ustedes
shows
podrán
their
observar
experience, we can
este
check
tipo de
this,
avances y
this
cómo
kind
han
of
logrado
advances
documentar
and how they
sus
have
acciones
reached
en
to
relación con la
document
eliminación.
their
Por
actions
ahora,
regarding
solo un
this.
país en el mundo
Up to now, only one country
ha
in
sido
the
reconocido
world
por la
has been
OMS
recognized by
después de un proceso de
WHO
verificación
after a
usando
process
los
of elimination
protocolos
using
actualmente.
the
Ha sido
current
reconocido
protocols.
en
They have
alcanzar la
been
eliminación bajo los
recognized
criterios
reaching the
actuales.
elimination under the
Esto
current
es importante,
criteria.
pero
This is
esperamos que los
important,
demás
but we
países que
hope that the other
participan
countries
en
that
esta reunión
participated in this meeting
tomen estas ideas y
will have
continúen
these ideas
abordando
and
estos
continue
aspectos no solo a
following
nivel
these
nacional,
aspects, not
sino
only
también
nationally speaking,
subnacional.
but also
Otra de las
subnationally.
preguntas que se
Another of the
nos hacía,
questions,
es importante recordar que los
it's
aspectos
important to
clínicos sobre
remind that the
diagnóstico y
clinical aspects on
tratamiento,
the diagnosis and treatment,
quisiéramos que las
we
preguntas
would like that the
sobre ese tema
questions
fueran
on this
abordadas
subject
mañana, porque mañana
are, will
vamos a
be
tener una
answered tomorrow,
sesión
because tomorrow we will
específica
have
sobre
specific
estos temas.
sessions
Es decir, si
about these
pueden
subjects. So if you
tratar
can
de abordar esas
just
preguntas mañana,
ask these questions
sería muy
tomorrow,
importante.
it would be very
Frente
nice.
a dónde
Now,
podemos
regarding
consultar las
where can we
herramientas que han sido
consult the
presentadas por
tools
el
that have
doctor
been mentioned
Vivek,
by Dr. Vivek
voy a
Lal,
compartirles
I'm going to
ahorita
share now
los enlaces de cada uno
the
de los
links
documentos
of each of the
técnicos
documents
en inglés y en español
in
donde
English and
ustedes puedan
Spanish
encontrar la
that you
descripción.
can
Hay un
find the
documento
description.
específico
There's a specific
sobre estos
document
temas
about
para
these
cada una de
subjects
las acciones
for
que se
each
requieren.
of the
Entonces
actions that are
los
required.
compartiremos
So we will share
ahí en el
this
chat para que
in
tengan
the
más
chat
facilidad
for you to have the
de
facility
análisis y puedan
of
acceder
analyzing
directamente
and access them directly,
específicamente y
specifically,
en términos epidemiológicos pueden utilizar el
and
análisis de sus
you can
datos,
use
utilizar
them
estas herramientas. Otra,
with the data and the tools. So
hay preguntas sobre temas
there's some
clínicos y
questions
de
about
diagnóstico
clinical
que sí,
and
como vuelvo y
diagnosis.
menciono, sería muy
And
bueno
as
poderlas
was
abordar
mentioned, it would be nice
mañana.
to talk about this
Entonces,
tomorrow. So
quisiera un poco
I would
resaltar
like
eso. No sé
please to
si
highlight
el doctor
this.
Vivek tiene algún
I don't know if
comentario sobre
Dr.
las
Vivek has
preguntas de
some
hasta el momento
comments
que se
about
han
these
hecho o
questions up to
quisiera
now.
resaltar algo adicional.
Would you like to add some comments, Dr. Vivek?
Doctor Vivek,
Dr. Vivek,
¿me puede escuchar?
can you hear me?
Yes. Yes, thank you. Thank you so much for the questions. I think it's very important that we continue to encourage countries to uh, get to undertake this process of interruption of transmission and elimination of leprosy disease. The idea here again is it is not an epidemiological zero. Elimination of leprosy disease is much more than just achieving zero adult case for 3 years and zero child cases for 5 years. It actually means that the country has enough capacity and capability to undertake a post-elimination surveillance. Leprosy, because of its epidemiology, sporadic case can occur at any point of time. And therefore, the country needs to be prepared to be able to provide the necessary services and an enabling environment for the verification process. So The verification, as I mentioned, it can be seen as a review process for the country as well. So that is very important. And that is what I wanted to add. Of course, we have Chile, which is advancing in its uh, undertaking this process of verification forward, and we would continue to support and encourage countries in this process. Thank you. Over to you, Nestor, if there are any
Ok.
specific questions.
Acá vamos a tener después de esta última
We will
pregunta
have
que
to this
de
last
Vivek,
question that I'm going to ask
que
now
podemos
to
compartir la
Vivek, that
experiencia.
we can share the
Es muy
experience.
pertinente la
It's
pregunta
very important, this
y
question.
la persona
And the
en el
person
chat de preguntas y
in the
respuestas
chat
está
of
diciendo, ¿qué
Q&A
diferencia hay
is
entre un
asking
caso
what difference
esporádico
is
y
in a
un caso
sporadic
aislado?
case and an isolated case. What's the difference?
No sé, Vivek, si quieres responder esa.
Yeah. Thank you. So we now have these standard definitions for autochthonous, non-autochthonous, and a sporadic case, and that is how we define. An isolated case can be a case which is linked or unlinked to an index case. But a sporadic case, there is no linkage to an index case. And that is how we define a sporadic case that can occur at any point of time. So at present, we do not have a concept of an isolated case of leprosy. We call it a sporadic case of leprosy. Over, Nestor. Over to you.
Ok, para poder adicionar a la respuesta de Vivek, digamos que en términos actuales de la definición de definiciones de eliminación,
I
el
would say
concepto de
that in
esporádico
elimination terms,
implica
in concept of sporadic
es un caso aislado, es
implies
decir, no,
an
no aislado,
isolated
no.
case not
Es decir,
connected to others. That is,
el concepto marco o
the
grande es
landmark concept
esporádico y una
is
característica
sporadic,
del el caso esporádico es que es
and
aislado, no
the case of
ligado a
sporadic
otros.
is that
No
it's
hay una
isolated.
conexión
It's not
epidemiológica
connected to another one.
visible
There's not
para poder
an
estar presente. Es decir,
epidemiological
que de
connection
alguna
that
forma el
is
concepto de ser aislado en términos de
possible to
ligado a
see.
otro
So, isolated
es
and not
implícito en la
connected to another
definición de
one
esporádico.
is
Pero bueno,
implicit
vamos
in the
a seguir
definition of a
abordando
sporadic.
más de las
But
preguntas
we'll continue approaching some of the
que
questions
se hacen en
here
el chat,
throughout
otras
the
durante las
webinar,
sesiones que
maybe in the
vayamos
chat,
teniendo.
maybe in the section where
Y
we can include
les
them.
recuerdo que las preguntas
And I
clínicas
want to
de
remind you
diagnóstico y
that the
tratamiento
clinical
las agradecemos
questions,
hasta en este
diagnosis, and
momento.
treatment,
Vamos a
we
tratar de
would appreciate if
responder
you can do it
todas las que se
tomorrow.
puedan.
We'll try to
Sabemos que
answer
son muchas,
all of them or
pero
most of
voy a
them
tratar
because we
de
know there are a
contestar
lot.
esas preguntas
But
de
we're
los
going to
temas
try
relacionados
to
a
focus today
eliminación
on the
y de
focuses
los temas
related
que
to
hemos hablado
elimination, such as the
en esta
ones that
sesión.
we've
Vamos a dar
approached in this
10
session so
minutos
far.
de
We're
break
going to
para
have a
hacer
10
el
minutes
almuerzo
break
doeste.
now
10,
on East
12 de la
time,
mañana, es decir, que retornamos
10
a
in the
las 10
morning.
y
So
2,
we'll
es
begin
decir,
at
en 10
10,
minutos.
12.
Muchísimas gracias. Retornamos en 10 minutos. Gracias.
So,
Thank you so much, Dr. Nestor.
colleagues, earlier I mentioned to you about the importance of strategies to interrupt transmission. In this context, I will introduce you to contact screening and post-exposure prophylaxis, which can help us achieve elimination. The 2018 WHO guidelines on diagnosis, treatment, and prevention went through a rigorous grade process on available evidence. These were assessed for quality of evidence, benefit to harm ratio, benefit to harm balance, equity, cost effectiveness, and feasibility. Owing to the long incubation period of leprosy, there is a role of subclinical infection. There is also a known risk of developing leprosy among contacts, an increased high risk. Post-exposure prophylaxis is defined as the administration of drugs to prevent the development of leprosy in a person who is or has been in close contact with a person affected by the disease and is therefore a higher probability that the person may have been infected. Single dose rifampicin has high bactericidal activity, is found to be effective, leads to a 57% risk reduction. It is feasible, acceptable, and cost effective. It has also been shown that there is a low risk of resistance from a single dose rifampicin. Contact screening and SDR-PEP or single dose rifampicin post-exposure prophylaxis, colleagues, should not be seen as an isolated intervention. It is a package of services which includes strengthened early case detection and prompt treatment through contact screening, enabling preventive chemotherapy to eligible contacts, support for capacity building of healthcare staff and monitoring of program, strengthened antimicrobial resistance surveillance, and enhanced community awareness. The contact screening and single dose rifampicin post-exposure prophylaxis is a systematic approach. Therefore, PEP is not the same as a mere mass drug administration. The WHO has developed technical guidance on contact screening and post-exposure prophylaxis. These need to be adopted and adapted by the countries. The training material is available for healthcare workers. Relevant advocacy and awareness materials and recording and reporting templates are available to support countries in scale up of this intervention. An effective contact screening and post-exposure prophylaxis comprises 5 steps. Identification of index case and providing counseling, counseling of contacts, examination of contacts, determining the eligibility and provision of single-dose rifampicin post-exposure prophylaxis, and finally, systematically recording and reporting. As per the annual data, which is reported by the countries on DHIS2, 91 countries undertook contact screening. 43 of these countries were able to screen the eligibles for administration of single-dose rifampicin. However, due to a lack of the availability of rifampicin, only 28 countries administered post-exposure prophylaxis. To address this need for availability of rifampicin, WHO in 2024 supplied rifampicin to 10 countries. This slide from Ethiopia depicts how administration of post-exposure prophylaxis helped to strengthen the contact screening process. You would notice that against a total of 3,041 index cases, 880 contacts were detected with leprosy, and over 10,000 eligible contacts were administered rifampicin. The post-exposure prophylaxis actually led to a strengthening of the contact screening process in the country. WHO recently received a grant from Novartis for a global scale up of post exposure prophylaxis. We have undertaken a gap assessment and preparedness questionnaire, a survey for countries to assess their preparedness and estimate the demand for rifampicin. A total of 63 countries reported to the survey. 59 amongst these requested for a supply of rifampicin. Based upon their level of preparedness, 42 countries out of the 63 have been identified for the first phase rollout. This includes 17 global priority countries. This is the map which depicts the selected countries for the rollout in the first phase later this year. Of course, our work does not end here. As we continue to explore better agents for prophylaxis, and at WHO, we are continuously following up on new developments in this area. For now, contact screening along with post-exposure prophylaxis with single-dose rifampicin is the best available strategy for improved early case detection, as well as to prevent development of disease and to interrupt transmission. Thank you. And over to you, Dr. Nestor.
Gracias, doctor Vivek, por su
Thank you very
presentación.
much, Vivek,
Supremamente
for
práctica.
your presentation. Very practical.
Yo creería que podríamos,
I
hay una pregunta que
believe
puede ser
that we
abordada
could
antes de
answer a
pasar
question
a la
that can be
siguiente
approached before we go to the
presentación.
next
Tenemos un poco de
presentation
tiempo.
so that we
Eh,
can
sí, hay
get some
un gran
time
número de
here.
preguntas en
There are
el
many
chat.
questions here in the
Hay una
chat.
pregunta que
There is one
tiene que
question
ver con aspectos
that
clínicos,
is
pero
related to the
también programas
clinical aspects,
programáticos.
but also
Por lo pronto,
programmatic
parece ser una pregunta
aspects.
desde
I believe it
Brasil.
is a question that
Dice
comes from
lo
Brazil,
siguiente,
and it
las
says the
pruebas
following.
rápidas utilizadas para
The
apoyar
quick
la detección de casos
tests
nuevos
used to
en los
detect new
contactos de
cases
pacientes con
within the
VIH
contacts with patients with
tienen buen resultado.
Hanseníase had
No sé si
a good
entendió bien la
result.
pregunta, doctor Quebec.
Does it have a good result? I don't know if you understand the
Es
question, doctor.
básicamente, si
Basically,
tiene buen
is
resultados el uso de
if there
pruebas
are
rápidas
good results, the
para
use
hacer
of quick
seguimiento de
tests
contactos,
to
para
do the
detección de
follow-up
contactos.
on
La
contacts and
detección de casos nuevos
detection
en
of
imágenes previas de
contacts of
contactos.
Hansen disease.
Así es.
Thank you.
Can you
Doctor,
hear me, Vivek?
can you hear?
Yeah.
Yeah. Thank you so much. If I've understood the question correctly, it's about identification of infection among the contacts. Now, so WHO released the target product profile last year for products for diagnostic tests, which would which would be the best diagnostic tests for diagnosis of leprosy disease, and the second one for infection amongst the contacts. And this would then help to give a post-exposure prophylaxis as well. We are currently undertaking a review of the available evidence because the 2018 guidelines is now dated, and we are looking to review the evidence available and to update the guidelines of 2018. So much of the evidence which has happened will now be put into that guidance, and we hope that the new guidance would be available and updated guidance would be available by next year. Thank you.
Muchas gracias, doctor Vivek.
Thank you,
A
Dr. Vivek.
continuación,
Following,
hemos
we,
observado, analizado
we've
los aspectos
observed and
epidemiológicos de la
analyzed
situación
the
epidemiológica
epidemiological
en el
aspects
mundo, en la región,
of the
los
process in the
conceptos
world and in the
actualmente
region, the fundamental
actualmente,
concepts of the
las
elimination.
herramientas que
Currently, the
utilizamos para
tools
el
that we've
monitoreo de la
used
eliminación
to
que
monitor
soportan este
the
contexto.
elimination that
Y
will
a
support this
continuación,
context.
el doctor
And
Subhana
following
del
now,
programa
Dr.
global
Subhana from the
Leprosy
global program
nos va a
of the
presentar
process
un
will
aspecto
present
especial que
an
tiene que ver
essential
con una
aspect
pregunta que voy
that is related to a question that I will follow again. A person that talks about the preoccupation of the situation in many countries and that we might have problems in the case registration. That is, I understand from this question that there might be a country that might be underreporting cases or reporting small cases. So that's why it's very important, the next presentation that has to do with expediting the reports, because as we mentioned in these presentations, the elimination of the process will not only be done with numerical data, but also showing certain evidences that the program, the commitment, and the surveillance in the countries are working, and what the countries are reporting is clearly what is happening, so that we can properly document this process. So, without further ado, I will pass the floor to Dr. Silvana for the global program of Leprosy. Dr. Silvana, you can share your screen. I believe you're sharing the screen, but I would ask you to put on presentation mode.
You can use the presentation mode. I can see it right now.
I can see now. Thank
The floor
you.
is yours. Thank you.
The floor is yours.
So thank you, Dr. Nestor. So it's pleasure to present to all the colleagues about the leprosy elimination dossier. Since morning, Nestor and Vivek have been mentioning about the leprosy elimination framework and the tools, namely the leprosy elimination monitoring tool, as well as leprosy program transmission program assessment tool. So now I'm going to talk about the leprosy elimination dossier. So I just wanted to give just a reminder to remind you all that this is the leprosy elimination framework. We have been talking about the phases. Phase 1 is until interruption of transmission, and phase 2 is interruption of transmission until elimination of leprosy disease. So until unless these two phases have been completed by a country, then it is time for the country to document the whole process and submit it to WHO, where for the verification of elimination of leprosy disease. So this is the timing. So as you know that the leprosy elimination framework, it's a bottom-up approaches, a process where we see all the data uh, and the milestones from the second level upwards. It has been captured, and once all the no autochthonous cases have been documented, that there are no autochthonous cases reported from subnational to national level, then that is the time when the verification process can begin. So the country has to prepare the dossier simultaneously. And today I'll be talking about the dossier preparation. What is this dossier and what are the contents and how it will be useful. So dossier basically it meticulously organizes the data which is being captured at the country level, which is taken up subnational upwards, and it should be a reliable data. So again, I want to reiterate here, the main purpose of the dossier is to systematically and thoroughly document the initiatives taken by the country to eliminate leprosy disease. So this is a detailed record of the interventions implemented in the country and the outcomes realized through the journey of the disease, with all the reports available and documented. And this has been collected by all the stakeholders together. The dossier also plays a crucial role in the verification process and functions as a repository of evidence, data, and insights that substantiate the claim of leprosy disease elimination. So this is a dossier which it's available on the website, and the countries can use this as a guidance tool to prepare the documentation of the dossier for submission. So this dossier essentially has 14 programmatic criteria. These are all the 14 programmatic criteria which is there in the dossier, which requires to be verified subnationally and documented and collected, compiled, and provided to national level. So national level, all the subnational levels from the provinces will be taken up, and the national level document is prepared. This is a integral part of the dossier. So this is all the programmatic components, epidemiological indicators about the health system, then mostly about the leprosy program management, and also how the services have been rolled out. And if a country has come to the phase of elimination, how does the post-elimination phase look like? The preparedness, whether the staff have been capacity built and they're able to diagnose the leprosy cases and initiate the treatment, and what are the policies regarding the contact tracing and post-exposure prophylaxis. And we also look at, apart from the epidemiological and programmatic aspects, look at the various social and community-based rehabilitations initiatives which is available, and also how the situation has been monitored. And we also look at how the inclusion has been part of the whole policy towards implementation of leprosy in the country. So this is very critical, and this is documented subnationally. And these are the core elements of the leprosy program transmission assessment tool. So this is documented subnationally, and at the national level, it is consolidated. So once this has been done as part of the dossier, this will be uh, part of the dossier, and it will be submitted to WHO. Even WHO, through its external review committee members, they'll also use the same tool, the leprosy program transmission assessment tool, to ascertain the situation is correct in the country during the visit. So what are the contents of this dossier? So the initial aspects are the background information, which is the introduction of the situation in the country, especially the health situation, and what are the general health indicators for health and development, and how the healthcare delivery system functions in the country. So along with the maps. So this gives a generic snapshot of the country health situation. And coming to leprosy, so here the evidences which the dossier should have is that it has to say that there are no new autochthonous cases reported in the country. That is, transmission has been interrupted, and there are no all cases of leprosy, autochthonous cases of leprosy, has not been reported according to the phase definitions. So we also look at cases, whether there are sporadic cases reported also apart from that phase, especially in the post-elimination phase, that can also be seen. So this is all captured in the LEMT tool. So that is the important aspect of having these tools documented. And we also look at the services of case management and whether disability management have been adequately addressed in the country, and the documentation of this to ascertain that these services are in place. And provisions to include leprosy affected persons, especially to manage the stigma and discrimination against them. So and whether these persons affected of leprosy are included in the program implementation and policy decision making. So this will also be looked at. So these are some of the evidences. And as a leprosy program transmission assessment tool, along with that 14 programmatic criteria, we'll also be looking at the political commitment. This is also one of the important aspects. Until unless there is a good political commitment for elimination of leprosy, the country cannot move ahead. And the next aspect is the program implementation components, which will be looked at, and the surveillance, especially post-elimination surveillance, whether the country is prepared for this. We also ask for additional information. It could be the mental health services, which is add-on services which will be provided to persons affected by leprosy. Then we also look at how the non-autochthonous cases have been managed, whether there's a policy for the immigrants, what is the health screening for them, and if among the immigrants, if leprosy cases have been diagnosed, how the treatment is initiated, or are the cases have been deported. So all these aspects we want to get additional information. So this will all be put together in the dossier as annexures. So again, I want to reemphasize that this is a bottom-up process where all this information is compiled a sub-district level to the district level, and again the districts to the provincial level, and all the provinces level, it forms a national level report. So once this information is available, then the country can submit the dossier to the country office, WHO country office. So again, WHO country office in turn uh, will facilitate or try to submit to the regional office where this information will be looked at. And finally, once they're convinced that all these informations are in place as per the guidelines, then a formal letter from the regional office is communicated to Global Leprosy Program. Then in the mutual consultation of the country as well as the region and Global Leprosy Program, external verification committee. These are all external consultants who are experts. They will be formed. There'll be representation from within the region, experts from within the region, and also from outside the region also, so that it's a balanced committee. And this committee looks at the dossier which has been submitted. They review it thoroughly, and they look for all the evidences which the country has provided. Once they're satisfied with all those things, then they will have a planned field visits to observe the service delivery process and also to ascertain the components which are stated in the dossier in the country by interacting with the various stakeholders in the country. So this is almost 5 to 6 days of field visit and interactions. So during that time, they'll have a briefing meeting with the ministry level and the Ministry of Health. And also at the end of the visit, they'll also have a debriefing meeting to share their experiences. So once the committee finds that the dossier um, is what has been submitted and what they've seen in the field is satisfactory, then a formal report has been submitted to WHO recommending to acknowledge elimination of leprosy disease. So this is the process which the external verification committee does. And here in this whole process, WHO will act as a facilitator between the country and the external verification team. And finally, Director General of WHO provides this letter acknowledging the elimination of leprosy for the country. So recently, as Vivek has mentioned, we have the experience in Jordan last year, where it has been acknowledged to have eliminated leprosy disease. So this is in brief how the dossier is been prepared and for what time it is been prepared and what are the components of the dossier and what is the process involved uh, after submission of the dossier by WHO with the support of external verification committee. So I think this gives a gist and summary of how the process is involved. So with this, I end my presentation. Thanks for your patience listening, and I'll be happy to answer to your questions. Thank you.
Ok, muchas gracias. Como pueden ver, hemos tratado de abordar todos los temas de una forma muy fácil, práctica, que ustedes sientan que no es algo difícil.
We've tried to approach these subjects in a easier way so that you don't find it too difficult. We have good timing, and we've been trying to answer the questions in the chat. There are some questions that are very interesting that are also challenging in terms of in programmatic terms, and I will try to summarize them. I'll begin with questions that are related to the approaches related to treatment, but in particularly with prophylaxis and what kind of regimen is used for prophylaxis. A question that I chose here is that is very interesting is how can you do the distribution of medication to treat the leprosy disease? So I want to take this question and if my colleagues want to add anything to it, I'll pass the floor to you. Additionally,
Como ustedes saben,
as you
la
know,
distribución de los
the
medicamentos
distribution of
para
medication
el
for
esquema de Lepra
leprosis,
desde los
uh,
años 80
the
nos ha sido
strategy of
exponencial,
leprosis
como
since the
mencionó.
1980s consists in a
Los
combination of
almacenamos
medications
en unos blister.
that we
Esos
put
blister
together
son
in
donados a través
blisters.
de la
These
Organización
blisters are
Mundial de la
donated
Salud. Es decir, que
through
podemos
the
decir que el tratamiento de la enfermedad de lepra
WHO,
o
so
lepra
we can say that
está
the treatment
garantizado y es
of
completamente
leprosis is
gratuito.
guaranteed
Cada
and
programa
totally free.
nacional tenemos una
Every national
estructura
program
definida
has a
anualmente con
defined
unos
structure. It is
formatos
defined
y
annually with
procedimientos
formats
establecidos en coordinación con el programa, con la Organización
that are
Mundial de la
established
Salud.
yearly
Se
with the
utilizan
WHO,
datos
and we
epidemiológicos
use
de
epidemiological
cada
data
país, los
for
completa
each
sin
country. Each
datos
country will
específicos
fulfill
de
them and include specific
nacionalidad y otras
data.
cosas. Y de acuerdo a las
And
características de cada país, la
according
Organización
to
Mundial de
the
la Salud o
characteristics
a
of each
través de la
country,
Organización Mundial de la Salud
and
se
through
hace la donación de
WHO,
los
a
medicamentos para el
donation, the
tratamiento
medication donation
de
is
lepra.
done for the
Por
treatment
otro
for
lado, tenemos
leprosis.
una
On the
situación
other
que es
hand,
la
we have a
profilaxis
situation that is
y como
the
se menciona,
prophylaxis post
el
position.
medicamento
As
utilizado es
mentioned,
rifampicina.
the medication is
En las Américas
rifampicil,
actualmente,
and in
el proceso
Americas,
de
currently the
adquisición de
process
rifampicina
of
lo
acquisition
realiza
for
cada país en cada
rifampicina,
país. Es decir,
each
es
country
diferente
will do
al,
it. That is to say
tratamiento
that
para la
it's
enfermedad de
different than
Hansen que se
the treatment
suministra
for
gratuitamente a
the
sus países
leprosis
a
disease
través
that
del
is
proceso de donación.
submitted
Para el caso de la
for
rifampicina como
free.
profilaxis,
But for
actualmente los países que
rifampicin as
están usando
prophylaxis,
esta medida de profilaxis
currently countries that
adquieren
are
de
using
alguna
this
forma el
prophylaxis, they
remedio,
will
el
acquire
medicamento. Esa
somehow
es
the
básicamente
medications.
la
That's basically
estructura. Como
the
lo
structure
presentó Vivek
as
ahora,
presented by
se
Dr.
está
Vivek,
buscando estrategias
and
para
we are
agilizar el
trying to find
proceso de
strategies
donación
to do
de
a
rifampicina,
donation
pero eso
process
aún está
for
en proceso
rifampicin, but this
de
is still
iniciación y
ongoing
seguramente cuando
and
se
in
inicie
early
se
stage.
empezará con
But
algunos
surely,
países
when it's done, we'll
específicos
begin
y
with
algunas
some specific
nacionalidades podrían
countries
establecerse dentro del proceso. Pero
according
ahora
to
quisiera
some
pasar
uh,
la pregunta,
process that can
la
be
siguiente
done
pregunta,
by
ya que
each
hemos
country.
visto
So
que
I
los
want to
sistemas para
pass the
tratar
next question that has to do
preventivamente
about the
al
system, the
tratamiento
preventive
de Vivek.
treatment
Tenemos
systems.
dos
I want to
preguntas.
pass the question to Dr. Vivek. Two
Esta es
questions,
la
actually.
primera.
Dr. Vivek, can you hear me?
Eh, ¿Sí?
Dr. Vivek, can you hear me? Okay.
Yes,
Entonces
yes.
tenemos dos preguntas
So we have two
específicos sobre
questions,
los
specific
regímenes
questions about
digamos, utilizados para la
how are
profilaxis.
the actions
Entonces,
that are
una
used for prophylaxis. One of
de
the
las preguntas,
questions,
y quiero retomar el slide
and
que tú
I
pusiste
want to go back to the
sobre
slide that you showed
regímenes de
about
profilaxis bajo investigación, es
uh,
decir,
strategies
cómo
for
es,
prophylaxis
digamos,
under
recomendados por
low
la Organización Mundial de
investigation
la Salud. Lo digo porque
recommended
hay
by
una pregunta
WHO. I say
en la que
that
nos
there is a
dicen
question
si un
that
país tuviese
asks if a country
rifampicina, que no es
has rifampicin,
rifampicina,
it's not
¿podría utilizarla para
rifampicin,
profilaxis?
can it use for
Esa es una
prophylaxis?
pregunta.
That's one
Y me
question.
gustaría que se
And
clarificara
I would like to
qué
clarify
regímenes está recomendando
what
la OMS
what is
y
required by
clarificar cuáles están bajo
WHO
investigación
and
y qué cosas
clarify which
aún no
ones are
están
under
recomendados
investigation
por la OMS.
and not
¿Está claro
recommended yet
la
by
zona para
WHO.
abordaje?
Is the
Estoy uniendo dos
question
preguntas en una
clear?
sola.
I'm
Creo que
putting
así es
together two
fácil que
questions here
sigas
in
con
one.
el enfoque de
I
estas
would like to know
preguntas.
if it's clear for you. What is the question?
Yeah, thank you so much. Thank you so much for the question. I think the most important thing is the 2018 WHO guidelines, and it clearly lays down that single dose rifampicin has been recommended for post-exposure prophylaxis. However, we continue to explore new research in this area and look at and encourage more research. We are aware that about the recent study on rifampicin, and as I mentioned earlier, the WHO guidelines itself would be looking at the new evidence which is being generated through such interventions such as rifampicin, a double dose of rifampicin, rifampicin plus bedaquiline. All these studies on chemoprophylaxis are being undertaken, and we are keeping an eye on these, following up on these studies, and these will be part of the evidence which will be put into the new updated guidelines, which is expected next year. Thank you.
Muchas gracias, doctor Vivek, por
Muito
su
obrigado, Dr. Vivek,
respuesta.
por sua resposta.
Particularmente quería agregar que tenemos actualmente la guía de OMS, que como dice Vivek, menciona o recomienda básicamente un esquema de profilaxis post-exposición y básicamente
And
con
basically,
rifampicina.
with rifampicin,
Esa guía menciona
this
que la profilaxis
mentions that the
se debe dar
prophylaxis
en mayores
should
de
be
2 años
done
con rifampicina
in over 2 years
personas que
old,
se descarta
and
tuberculosis y se
people that don't
descarta
have
lepra
TB
y
and
en
don't have
personas que no
leprosy, and
tengan
in people
o
that don't
o
have
no se puede dar
or
en personas que
that
tengan
couldn't be given
contraindicación para el uso de
uh,
la
any
rifampicina.
indication
Digamos, es
for the
básicamente
use
eso.
of this medication.
Pero
That's
lo que está
basically
haciendo el
what has been
programa
said.
global es
But what the
tratando,
global program is
probablemente con
doing,
una
and
nueva guía,
probably with a
de
new
buscar
guideline,
nuevas
is to
evidencias
find new
para mostrar si
evidences
hay nuevas
to
opciones
see if there are new
terapéuticas y
options
terapéuticas para
for the
abordar la
therapy
profilaxis exposición
to
y una vez
consider the
estén disponibles
prophylaxis.
seguramente
And once they
la
are
Organización Mundial de
available,
la Salud a través del
the
programa global hará las
WHO, through the
recomendaciones
global
del caso.
program, will give
Ah,
recommendations on this.
hay una
There is,
If I,
sobre cuándo debería
regarding
administrarse
when
una
should we
pregunta sobre
give
cuándo es
this, that's a
posible
question.
administrar
When is it
eh,
possible to give
la profilaxis
the
post
prophylaxis
exposición en un contacto.
after
Voy a ser un poco más específico,
contact?
Vivek.
I'm going to be more
Ah,
specific.
sabemos que
We
los
know
contactos son
that the contacts
pues identificados, pero
are
pueden haber
identified,
contactos
but there you can have contact
detectados y en
that
un
are
momento
detected,
dado
and in a
son
specific
abordados por
moment,
los
they are
servicios de
considered
salud un
by the
mes, 2 meses,
service,
3 meses o a
social
veces
health
un año
services,
después de que el caso
one up to 1 year
públice
after
fue
the beginning of the
notificado o reportado.
case
¿Cuándo
that has been identified or
debería esa
reported. When
profilaxis
should
ser
this
suministrada?
prophylaxis be
Básicamente es
given?
la pregunta.
That would be the question.
yeah, I believe that question is for me, Nestor.
Yes, it's for you.
Yes,
That question is
thank
for
you.
you.
So there is no particular guideline which specifies when the contacts are eligible to be provided post-exposure prophylaxis. Several countries, what we encourage is that the countries should do contact screening and undertake post-exposure prophylaxis as soon as as an index case is detected. Again, to specify and to underline the most important thing, that post-exposure prophylaxis must not be seen as an isolated intervention. Please see that as an intervention which is a combined strategy of contact screening and post-exposure prophylaxis with single dose rifampicin here. This will help us identify new cases in a timely manner much before nerve impairment sets in, and also help those people who have not, those contacts who have not developed the disease. It will prevent their development of disease. Some of the countries have also tried to pool in index cases from the past 3 to 4 years and then provided them rifampicin based upon the contact screening. And so there is no particular guideline to guide when this can be undertaken.
Muchas gracias, Vivek. Thank you so
Thank
much
you very much,
for
Vivek.
your answer. I'm going to uh, share with you, Vivek, once again, another important question. I'm going to speak in English because it's in that way I think you can clearly understand my question. And this question I think is for you, Vivek. The question is, as you know, there is problems that related to the rifampicin production and distribution. So, what do you think how a country can manage uh, the process of curing rifampicin of the medicines in an scenario with that kind of difficulties? Thank you.
Thank you so much. In our own experience, last year when WHO had started supply, as I mentioned in my presentation, supply to 10 countries, there were problem with active pharmaceutical ingredient and to get that to manufacture rifampicin. So there are production delays. However, the rifampicin supply was made we were expecting the supplies to be available within 3 months. It became available only by 5 months. So we are already looking at those delays and are in discussion with multiple manufacturers so that this delay can be offset for the countries. Thank you.
Muchas gracias, Vivek, por tu
Thank you,
respuesta.
Vivek, for your answer. There are a lot of questions from everybody regarding prophylaxis. There's another question. It says, as we have mentioned, there is a process to have blisters for the treatment of leprosy. We use a scheme, a uniform scheme that use 3 drugs, Dapsona, Nifapsina, and Nimicacina. These drugs are donated by WHO, and the countries are benefited by this process. But there's a question that says, so for Rifamycin, that is the drug used for the prophylaxis, you have to be acquired by the country? I will answer this question. Currently, as I mentioned, the countries of the region that are implementing the prophylaxis post-exposition are acquiring themselves rifamycin. With the global program, we're working to establish donation of this drug, but this is still not being implemented. And if it should start, it is probable that it should be with a basic beginning with few cases, and specifically in some countries that have some initial characteristic. But for now, rifamycin as prophylaxis post-exposition is not being donated by WHO. So, another question, clinical one.
To ask Vivek once again to this question about the single dose of rifampicin. And I already mentioned that we have the opportunity for 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 providing the rifampicin in contacts in which we already discard tuberculosis, leprosy. The contact needs to be older than 2 years, and in contacts that we cannot use rifampicin, that indication is not possible for that kind of contacts. But a person is asking if in pregnant women there is option for providing the single dose of rifampicin. It is possible to use rifampicin for that purpose in that group of population. Thank you, Vipek.
Yeah, thank you so much. As per the current guidelines of WHO, pregnant women are excluded from receiving rifampicin chemoprophylaxis, which is because the study on which it was based, this recommendation was based, excluded pregnant women from the study, and therefore the recommendations are based largely on that study. Current recommendations, therefore, do not advise or recommend single dose rifampicin among pregnant women. Thank you.
Thank you, Vivek. We have a lot of questions about that. Another interesting question is because it's about the prophylaxis, and I would like to emphasize that probably most of the programs are focused in household contacts, but in some scenarios we have other kind of contacts, social contacts, contacts in the school, contacts in the job of the case. I would like to ask Vivek, how should be the approach? This is a question from the chat. How should be the approach for contacts among contacts that we can find in the school and in the job, for example, and how to manage that process. But it's important to have in mind how to manage aspect related to the privacy of the index case and how to manage stigma and discrimination in that kind of approaches. Thank you, Vivek.
Thank you so much. That's a very difficult question to be answering in the first place. The most important thing, one of the principles to be applied to contact screening and post-exposure prophylaxis is counseling. Counseling of the index case and counseling of the contacts. Only if the case, index case, is willing for disclosure and is willing to provide a detail of the contacts, do we then go in for a contact screening. And also, again, as I had mentioned in my slides, counseling of the contacts again becomes very important. It's a bit tricky when we do it for school children and also for workplace, but again, confidentiality, disclosure, stigma, and discrimination are very, very important, and we need to be mindful about that. So again, no clear-cut answers for that. I think we just need to look at, we need to ask the case themselves whether they are comfortable in providing the list of contacts and then go through the contact screening. Thank you.
I think another question is that many questions are related to the same point. Uh, for example, in addition to that, Vivek, one person is asking with the same situation if the index case is detected in a prison, how to manage that situation.
I think these situations are best managed through I think, the political situation in the country. What is the public health? How is the public health guide such situations? This is not peculiar to leprosy. I think the same situation would apply to tuberculosis in prisons. And every country has their public health uh, measures in place for transmission, for preventing the transmission of such diseases in closed spaces such as prisons. So I think we need to be mindful about that and apply the same thing in these contexts. Thank you.
Okay, thank you, Vivek. We have another question uh, that is important also. What happens if in a situation, in case of absolute contraindication for providing the prophylaxis post exposure is not possible because the case is we cannot provide the rifampicin. What kind of action we can follow in that kind of cases?
I think the most important thing is, again, let's not look at post-exposure prophylaxis as an isolated activity. It is contact screening along with post-exposure prophylaxis. It has its own systematic approach through indications and contraindications. If there are contraindications to providing rifampicin, then we should not provide rifampicin to that particular contact. In that case, it would suffice. Some of these contraindications might settle down with time. For example, liver disease or some other problems, and then the contacts can be followed up again and provided at the time that that contraindication has settled. Thank you.
Thank you, Vivek. I would like to try to complement the answer. It is important that you can understand that the prophylaxis post-exposure for leprosy is not a mass drug administration. It's an action that we have to define how to approach every single case, every single contact. You have to evaluate every contact. Every contact needs to receive a complete examination, clinical examination, and if that contact we can use the prophylaxis, we can do it. But you have to do an evaluation for every single contact. It's important that you have this kind of situation in mind. Uh, I think uh, there is another question, probably it could be complement to all the questions. How do we determine if a contact is eligible for prophylaxis? I don't know, probably Vivek, you can summarize, because it's an interesting question that can summarize how we can define if a contact is eligible for that aspect. Thank you.
And thank you so much for this question. And that summarizes the entire presentation on the topic on contact screening and post-exposure prophylaxis. The most important thing, every contact is to be examined thoroughly for leprosy, because the contacts are likely to have increased likelihood of having leprosy. That is the first important thing. The second important thing is tuberculosis, and that's an area where leprosy can add. So if they have to be excluded from for having tuberculosis. After having done these two important things, it is important to also exclude for children less than 2 years for any liver or kidney disorders and pregnancy. And once these have been excluded, the person can be safely administered post-exposure prophylaxis with single dose rifampicin. Another important thing is contraindication is that if the person has already received rifampicin for any other indication in the past 2 years, we would like to not provide rifampicin in that case. So if we follow these five indications, contraindications, we would be able to provide them with single dose rifampicin. Again, it's a systematic approach, and that approach is not the same as mass drug administration, as Dr. Nestor mentioned. It is a systematic approach which needs to be recorded and reported in a proper manner. Thank you so much.
Thank you, Vivek, for your interesting answer. I would like to have opportunity for bring another important question related to BCG vaccine. One person, uh, uh, one person is asking about regarding the tuberculosis vaccine, and the question is originally in Portuguese, and I'm going to try to translate. I think this question is also for you, Vivek. Does it actually provide protection against the more severe forms of leprosy in context? And in what way does the vaccine contribute to the elimination of the disease? Or is there no supporting evidence for that? So, particularly, this question is about if the vaccine with BCG is useful for the action related to leprosy, and mainly about the contacts in this case. Thank you.
Thank you so much. The WHO guidelines makes a very strong recommendation for BCG vaccination, and BCG vaccine was found to be protective. However, the problem is that BCG has variable efficacy, effectiveness at field level. It may vary for just around 10% effectiveness to a 70% effectiveness, and that is what makes it very difficult to assess. However, there is a strong recommendation for BCG to be administered amongst the contacts, and that would effectively reduce leprosy development amongst the contacts. Thank you.
Thank you. That is another very interesting question. I have another one that I would like to try to explain. That is, it's quite difficult, the case, but it's particularly interesting. If we have, tuberculosis and leprosy sometimes have some kind of linking related to some approach. And this question is, I'm trying to translate to the question is, if a patient has been diagnosed with tuberculosis and is resistant to rifampicin, but that kind of resistance is related to the tuberculosis, not leprosy, but has also been exposed to leprosy. That means there is a contact, for example, a household leprosy contact, and require prophylaxis post exposure with rifampicin. How we should proceed in that case?
I'm sorry, but because, again, very interesting question, but because there are no guidelines for the same, it's very difficult to assume. But what is important is the principle here that the person is already resistant to rifampicin. It is unlikely that there would be any effect as even if provided as post-exposure prophylaxis for that particular case.
Thank you. It's a very interesting question, but it's quite deep, complex. But I think it's important to understand that in different kind of situation, there is no a very specific uh, answer. But I think every case, when we don't have a pattern from the WHO, you have to analyze the specific situation and give, probably with the support of some experts, what could be the best option for that case. But there is another question. It's about new perspectives, yeah, new option that we can have for prevention. And somebody is asking, what is the current status about the new vaccine called LepVax? What is the perspective, and is going to be available soon, or and how is the process related to that?
Yes, I think the trials on LepVax are encouraging, and it's progressing. It'll take a while before we have the results on that. So the phase 3 trials, I think they are being undertaken in Brazil and India. So we will be hearing about it in the coming years. But it'll take a while before we know more about LepVax and how it works. But coming back to the previous question, Nestor, which you mentioned, I think antimicrobial resistance surveillance with regard to rifampicin is a very, very important aspect. And this is one thing which needs to be strengthened at country levels, especially the countries which are also providing single dose rifampicin. So I just wanted to make that important point. Thank you.
Okay, there is a lot of number of questions. There is another. Uh, it's basically about the level of exposure that a contact can have for define it is the contact eligible for prophylaxis. So the question is, what level of exposure does one person for being eligible or considered for prophylaxis post-exposure?
So I think the contacts have already been defined as for household contacts, social contacts, neighborhood contact. If they've spent in leprosy, I think what is more important is how close the contacts are related. And if it is a close, prolonged contact, the person would qualify to be a contact eligible for post-exposure prophylaxis. Thank you.
Thank you, Vivek. Changing the topic about prophylaxis and rifampicin, somebody is asking how can try to involve the governments in the process related to the elimination of leprosy. How to engage that group of person that can have or can define the policies for a country in that process.
I think elimination of leprosy in itself is a very strong concept. A country which has been able to eliminate leprosy is resonates not just on medical aspects but also the socio-cultural aspects, social aspects in the country. And uh, this particular aspect of elimination is very important, and this would probably help get political commitment on the elimination process itself in the country. So when especially in case of leprosy, this is very important to be able to provide the social support. Enabling environment for persons affected by leprosy is an equally important component as a post-exposure prophylaxis or a contact screening. Uh, Leprosy has afflicted mankind for several years. And I think this entire concept of elimination, that, for example, Jordan has been able to eliminate leprosy, is a huge thing, not just in terms of epidemiological achievement, but also the social and the environmental achievements which have been made in the countries so as to be able to eliminate the disease. Thank you.
Thank you, Vivek. Another question, it's about, as you can see, we mentioned in our region, there is a group of countries mainly located in Central America, two countries in South America, Chile and Uruguay, and a group of countries in the Caribbean. Then probably they are close to achieve the two milestones. But what we can say to those countries? They currently has a very important number of cases. For example, Venezuela, Paraguay, Colombia. How can perceive that kind of milestones if they are probably far from the goals at the national level? What kind of actions they can use for accelerate the process, or how they can have the hope for reaching the goals.
Thank you so much, Nestor. I think a very interesting question, and this comes up again and again. What is it in it for the countries which still report a large number of new cases? Now, what is important in this particular leprosy elimination framework is that it is subnational level upwards. We must start recognizing the achievements at subnational level. And I think this can be done with all the countries because leprosy is basically a disease which is clustered. So it may be there in one part of the country, but still may not be there in another part of the country. It's important that the same tools, the leprosy elimination monitoring tool and the leprosy program and transmission assessment tool, the country can already start assessing them from subnational level upwards. Now, this is very important because this is different from the the this is what we have borrowed as an experience from the previous uh, elimination, the concept of elimination of leprosy as a public health problem. That was at a national level. However, this elimination and interruption of transmission is at subnational level, a bottom-up approach. And so every country, despite the fact that they may have several cases, they can still take up this process of review through LEMT, and LPTA. And finally, at some point of time, through certain interventions, as we also mentioned about contact screening and post-exposure prophylaxis, they may be in a position to come up with to the stage of interrupting transmission. Thank you.
Yes, thank you. I think most of the questions are already answered. And thank you for answering, Vivek. I just want to highlight that tomorrow we are going to have a very specific session with the support of one of the PAHO WHO collaborating centers that we have in Brazil. And we are going to talk about diagnosis and treatment. So once again, I would like if you can share with the colleagues in your country that you believe they can be involved in aspect related to leprosy, that they can join us tomorrow as well. So I think we can start the closing of this first session, and I would like to thank you, Vivek, for and your team from the global program for supporting us in this process. So I would like if Anna, you can hear me. Anna.
Sí, Néstor.
Okay. Uh, okay. So we are going to start the closing of this first session. I would like to invite Dr. Ana Lucenes for giving us some comments, final comments for this first webinar session. And after Dr. Ana, I would like to invite Dr. Vivek for giving us the final remarks from him. Thank you so much, Dr. Ana.
Muchas gracias, Néstor. Bueno, hemos llegado al final
Thank
del
you very
primer día de
much. Next,
webinar
so we've come
centrado
to
en el
the end
tratamiento
of
de
the
lepra.
first day of
Esperamos
webinars
que le haya
centered
sido
in
útil la
the
información que
elimination of
compartí de las herramientas de monitoreo del
leprosis.
avance y el
I
proceso
hope
de
this was
dosificación y
useful,
verificación
how
de
to share the
eliminación de
information
lepra.
on the
Bueno,
monitoring
nos
and the
alegra mucho ver tanta
verification
interacción e
of the
interés de su
elimination of
parte a través del
leprosis. We are
chat.
very happy
Esperamos
to
que hayan
see
sabido.
so many
Quedamos a su
interactions
disposición para
in the
apoyarles a
chat. We are
avanzar
here
en el proceso de
available
eliminación
to
en
help
sus países.
advancing in the process of
Como
elimination
Néstor indicaba,
in
el
your countries.
contenido del
As
webinar
Nestor pointed
con la
out, the
agenda, mostrará en
webinar
la agenda que mañana
with
tendremos la
the schedule for
oportunidad de escuchar
tomorrow,
la
having the
experiencia de
opportunity
Chile en
of
su proceso de
listening to
planificación,
Chile's
monitoreo y
experience
verificación
in the
del
process
proceso de
of
eliminación de la
monitoring and
lepra. Será al
verification
principio
of
del
the
webinar y
leper
mañana
elimination.
les
And
agradecemos
tomorrow,
enormemente su participación y el
we
compromiso
really
que
want to thank
ustedes en sus
you
países han
for your
demostrado
presentation and
al
the
estar hoy
commitment.
aquí con nosotros. Agradecer a los colegas del Programa Global de Lepra,
We
Vivek y
want to thank
Subhana, que
everyone,
nos han
the
explicado
global
desde la mañana el
project,
proceso de
Vivek
eliminación y
and
cómo identificar los
Subhana,
contactos de una persona afectada de lepra y
and how to
tratarlos.
affect,
Creemos que es muy
how
importante
to
su
understand
atención.
how the
Gracias también al
patients are
Programa Regional de Enfermedades
affected.
Tropicales
We want
Desatendidas,
to thank
a
the
Néstor
programs
por
for
toda la
non-attended
planificación
tropical
de este
diseases
webinario, al
program
equipo de
and
terceras
everyone that
llamadas, a
was
Rosa, Herbera, Juan David, a Ana
responsible for this
y finalmente a los
process,
intérpretes
Rosa, for the
que nos han
production of this
permitido que
event
todos
that
pudiéramos estar
allowed us
siguiendo hoy el webinario.
to
Nos vemos mañana
be
en el segundo
here
día
in
del
the call.
webinario,
We'll
donde tendremos la
see each
oportunidad de
other
revisar la
tomorrow
parte
when we'll have the
diagnóstico
opportunity
y
of
tratamiento de lepra,
reviewing the
con la
diagnosis
participación, como bien decía
side of
Néstor, de
the
panelistas, de
leprosis treatment
colegas del Centro Colaborador
with
de Lepra, de la
the
OMS, del
Center
Instituto
of
Lauro de Sosa Lima.
Leprosis
Y
Collaboration
por favor,
Institute, Lauro
compartan
de
los
Sousa
enlaces con
Lima.
sus
Our colleagues
compañeros
from
de
there will
lepra de
be
los
tomorrow with
niveles
us,
subnacionales y de
understanding
niveles
the
locales para que
subnational and
puedan
local
aprovechar al
levels
máximo
and how to take
este
advantage
webinario.
of this
Muchas gracias
webinar
de nuevo
tomorrow.
y nos vemos mañana. Le paso la palabra
Thank you very much, and I pass the floor to Dr. Vivek.
Thank you so much, Anna. And at the outset, thank you so much for a wonderful interaction here. I thank PAHO and all the countries and country representatives here, the national program managers and other experts who joined us for this webinar. Just a few final things which I wanted to bring about here, that elimination of leprosy is a significant paradigm change in leprosy. It's a moment for us to revitalize the leprosy programs in our countries. And it's not merely epidemiological numbers. It goes much beyond that. It talks about surveillance, it talks about persons affected by leprosy and how discriminatory laws must not be there, enabling environments must be created, and political commitment. Elimination of leprosy is feasible. It has been exemplified through the success which Jordan has made, and I'm sure several countries in the region are eligible and will be encouraged to take further this particular process because this allows country efforts to be recognized in leprosy. Finally, we have the tools to support the countries, to support you for verification. These have been digitalized to improve efficiency, and please count on us for any support in this regard. Thank you so much once again. Muchas gracias. And over to you, Dr. Nestor.
Ok, muchísimas gracias a todos, muchísimas gracias a los panelistas, al equipo de
Thank you very
intérpretes, al
much
equipo
to
de
everyone, to
OPS,
the team of
por
interpreters, the
dar
OPS
esta
team,
oportunidad a todos los países
to give
invitados
this
de
opportunity to
conocer
all the
mucho más
countries
sobre
that
la
were
enfermedad
invited
y los temas
to know
relacionados a la
in
leprosis.
detail the subjects
Nuevamente
related
quisiera
to the
decirles que
disease.
esperamos
So I
que
just want
mañana nos
to
acompañen
say that
en
I
ese
hope that
escenario un
tomorrow
poco
you will join
diferente,
us
pero
again in a different scenario,
dedicado
but
específicamente
dedicated
a los
specifically
aspectos
to
clínicos y
the
terapéuticos de
clinical
la enfermedad.
aspects and
Entonces, sin
therapeutical
más
aspects.
preámbulo, muchísimas gracias. Nos
So
vemos mañana.
without further ado,
Feliz día, feliz tarde para todos, feliz noche para algunos. Muchas gracias.
have a good day. Enjoy the day, everyone. Thank you.